Now, for those of you wondering, what about the more catastrophic, worst case scenario? Let's finish and look at John. John rarely goes to the doctor during his first year on Medicare, but in year two, he receives a surprising diagnosis that he has end stage renal disease and will need dialysis and many treatments for years to come. In this case, our projections for John, they will consider what happens if someone has to pay their full Medicare Advantage maximum out-of-pocket limit each year. Let's look at John's estimated out-of-pocket cost over time for these plan options in Michigan. Unsurprisingly, we see that all of the Medigap options have lower projected costs compared to Medicare Advantage options, with the high deductible Plan G being the closest to the Medicare Advantage plans, and with Plan N having almost half of the estimated long-term cost as many of the Medicare Advantage plans. If John were to live in the Texas market instead, we still see that Plan N and Plan G have projections that are the lowest overall, but now there are HMO Medicare Advantage plans that are a bit closer to the Plan G and are actually lower than the high deductible G. However, the PPO costs, they still remain high overall. Lastly, if we look at our final example in Tampa, we see a very different trend compared to the other two markets, as you might expect by now. In this case, even with the worst case projections for John reaching his maximum out-of-pocket limit every year, there are still HMO plans that have long-term estimated costs lower than the three Medigap options. However, as you can also see, this is heavily dependent on the Medicare Advantage plan and whether it has a low maximum out-of-pocket limit compared to other plans on the market. There are still Medicare Advantage plans in this case with estimates close to double that of Medigap options.